steadily mounting evidence shows that Americans, even at a late age, can improve their health and the quality of their lives by adopting healthy behaviors. Older people in good health, those with short-term illnesses, and those with chronic health conditions can all benefit from health education to help them develop a more healthy lifestyle and better health. The goal of Mission Well-Being is to encourage healthy behaviors and to improve the quality of life.
Our lives have been greatly enhanced by the advances in diagnosis and treatment in the medical profession during the last half of this century. Newer and more effective drugs are among the major factors that have contributed to an improvement in the health and well-being of our senior citizens. Those over 60 years of age now make up about 1/6 or 17% of our population, but they use almost 40%, that's nearly half, of all the prescription drugs dispensed each year. This makes seniors the largest single group of consumers of medicines. The average senior takes 4 medications daily and has 13 to 16 prescriptions filled annually. Those over 65 have twice as many prescriptions filled every year as those under 65. The tremendous advance in drugs and drug therapy has been responsible for a significant decrease in mortality from heart diseases, high blood pressure, diabetes, and many other illnesses, which often led to a decreased life quality and a shorter lifespan. But what we must recognize is that drugs should be used as prescribed by our physicians if we are to experience maximum benefits and avoid problems that are often associated with their use. Very often we may find that we have problems even when we faithfully follow directions. The objective of this first segment in our series on drugs is to discuss some of the factors that often contribute to medication problems and what we, as patients and consumers of drugs, can do to prevent or eliminate many of these problems. Our host for today is Dr. Frank Pettinato, Professor Emeritus of the School of Pharmacy and Allied Health Sciences at the University of Montana.
Hello? Okay.
Frank, welcome to our show.
Thank you, Nancy. Yes, you're certainly right about the benefits we enjoy today. Because of the many advances in medical treatment, both our quality of life and our life expectancy have been greatly enhanced. In fact, our life expectancy has increased rather dramatically in this 20th century. Part of this is due to the newer, more effective drugs available to us today. But these more potent drugs do carry some risks if they're not used properly. The purpose of this presentation is to look at some of these medication problems, their causes, and what we can do to reduce or to prevent illnesses caused by the drugs we take. We'll discuss first some of the factors causing medication problems. We'll look at over-medication, adverse drug reactions, why more of these adverse drug reactions occur in older patients, what the extent of the problem is. In our next presentation, we'll look at problems that are associated with multiple drug use, multiple providers. We'll discuss some rules for safer drug use, and will provide a summary of some selected drugs that cause the most detectable problems. Let me begin by asking a question. What do these 5 people I'm going to mention have in common? A 58-year-old man who has just developed Parkinsonism, a 68-year-old woman with a hip fracture, a 63-year-old woman whose daughter says her memory and her ability to think are slipping, a 62-year-old man with a recent onset of extreme dizziness and occasional fainting when he first gets up, a 52-year-old woman who suddenly died while having some dental work done. Obviously, the one thing they all have in common, they're all over 50. But the principal thing that these 5 folk have in common is that they are all victims of serious but often preventable adverse drug reactions to prescription drugs. It's estimated that among the older population, 10 to 20% of all emergency room admissions are due to adverse drug reactions or to drug-induced illnesses. Let's look at some of the factors that contribute to this problem. On the chart here, we've indicated that 1/6 of the population takes about 40% of the drugs, and that when we enumerate the drugs that we take, we see that we take 33% of the tranquilizers, such as Valium, Librium, Xanax, etc. These drugs lose their effectiveness after 4 months or so. So we often wonder why they are prescribed so extensively and for such long periods of time. We take 33% of all the major tranquilizers, such as Stelazine, Thorazine, Haldol, etc. These drugs are the major culprits in causing the drug-induced Parkinsonism, that is, the shaking, shuffling gait, etc. We take 50% of all the sleeping pills, Dalmane, Halcion, Restoril. Now, these pills are usually effective for only a month or so, but some folks take them for as long as a year. We take 33% of the antidepressants, such as Sinequan, Elavil, Norpramin, Tofranil, Prozac, etc. Some of these can cause mental confusion, disorientation, dry mouth, urinary problems, constipation, and so forth. We take 67% of all the high blood pressure drugs, such as Calan, Cardizem, Capitan, Procardia, Aldactazide, and so forth. Some of these drugs can cause depression, sedation, cause dizziness on standing, and accidental falls and broken bones. And we know that mild high blood pressure can often be successfully treated simply by changing our lifestyles, losing a little weight, restricting salt intake, restricting alcohol, mild exercise, decreased fat intake, and increased fiber. These can all often help to take care of a mild case of high blood pressure. We take 87% of all the digoxin. As many as 20%, or 1 out of 5 people on digoxin, develop signs of toxicity at some time or other. One study has shown that many long-term users of digoxin can stop using the drug successfully under careful medical supervision. And again, I emphasize, under careful medical supervision. And they can do this without any harmful effects. We take 43% of all the gastrointestinal drugs, the antacids, the anti-gas preparations, excuse me, antidiarrheals, laxatives, antispasmodics, etc. Drugs like Zantac, Tagamet, Lomodal, etc. Many of the ailments for which these drugs are prescribed can be treated simply by changes in diet, such as adding more fiber, less fat, reducing alcohol, reducing caffeine intake, quit smoking, mild exercise. All of these measures will very often take care of some of our mild gastrointestinal problems. Let's look at some of the adverse drug reactions. Now, adverse drug reactions are simply an abnormal response to the normal dose of a drug. These abnormal reactions occur 2 to 3 times more frequently in the older population. Some of these adverse drug reactions are not serious. However, some of them can cause serious injury, hospitalization, and oftentimes they can be fatal. On the chart, we see some changes which are frequently caused by drugs. These are changes which we often attribute to growing old. We simply shrug our shoulders and tell ourselves that we're over 60 or 70 or 80, so what can we expect? It's just old age. We fail to realize that many adverse drug reactions may cause these similar symptoms. In other words, the mental confusion, the nervous system disorders, the dizziness, gastrointestinal difficulties, urinary problems, any of these can be caused by drugs or a combination of the drugs which we may be taking. Now, why are there more adverse drug reactions in older adults? I mentioned earlier that these adverse drug reactions are 2 to 3 times more frequent in older patients than in the younger population. Let's see why this is. First of all, as we grow older, our bodies get smaller. We experience a different body composition. Generally, we weigh less. We have a smaller amount of water and a larger proportion of fat than younger adults. Body weight increases from the time we're 40 to 60, mainly due to fat. Then it decreases from 60 to 70 and declines rather sharply from 70 on. Therefore, the amount of drug per pound of body weight or per pound of body water will often be much higher in the older adult than in a younger person. If the same amount were given to a younger person, they may not experience any problems at all. But the younger person or the older person may have an adverse drug reaction. In addition, drugs which concentrate in the fat tissue may stay in the body longer because there's more fat for the drug to accumulate in. It's released more slowly over the period of time and therefore can have prolonged effects. That may be why, or one of the reasons why sometimes a drug that we take as a sedative may keep us groggy or dopey all day long. Decreased ability of the liver to process drugs. Because the liver doesn't work as well in older adults are less able than younger people to process certain drugs so that they can be excreted from the body. This has important consequences for a large proportion of drugs which are used by older adults to treat high blood pressure and heart conditions, as well as many other drugs that are processed by the liver. The ability to get rid of drugs such as Xanax, Valium, and many others is affected by this decrease in liver function. Next, the decreased ability of the kidneys to clear the drugs out of the body. As people grow older, the ability of the kidneys to clear many drugs decreases steadily from the age of about 35 to 40 on. By the time we're 65, the filtering processes of the kidney have decreased by about 30%. This process gets worse with age, along with other aspects of kidney function. The effect of the action and duration of action of drugs then is sometimes greatly increased. Increased sensitivity to many drugs. The problems of decreased body size, altered body composition, that is, more fat, less water, and decreased liver and kidney function causes many drugs to accumulate in the older adult's body at dangerously high levels. These are age-related problems, and they're further worsened by the fact that even at normal blood levels of many drugs, older adults have increased sensitivity. Their effects often resulting in harm. This is especially true of drugs that are central nervous system depressants, such as sleeping pills, alcohol, tranquilizers, potent painkillers like morphine or Talwin. This is also true of many drugs that have an anticholinergic effect. In the anticholinergic group are the antidepressants, antihistamines, antipsychotics, and drugs that are used to calm the intestinal tract. Decreased blood pressure maintaining ability. Because older adults are less able to compensate for some of the effects of drugs, they experience more adverse drug reactions. The best example of this is seen when you get out of bed or when you suddenly rise from a seated position. As you rise, the blood pressure normally falls. This decreases the blood flow to the brain. In younger people, this is no problem. They compensate for this readily. Receptors in the neck, which sense that the blood pressure is falling, will send a message to tighten up the blood vessels elsewhere in the body so that the blood pressure then is maintained high enough overall. In older adults, these receptors don't work as well. Often upon standing, older adults feel giddy, lightheaded, and dizzy. This problem of postural hypotension, that is, the sudden fall in blood pressure on standing, brought about by a combination of aging and drugs, can often be catastrophic. The falls which often occur can result in hip fractures or other serious injury. Some examples of drugs which further weaken the ability of the body to maintain blood pressure in older adults are obviously the drugs that are used to treat high blood pressure, sleeping pills, tranquilizers, antidepressants, antihistamines, drugs that are used for treating angina, and drugs that are used to restore normal cardiac rhythm. Decreased temperature compensation. Younger adults can more easily adjust or adapt to very high or very low temperatures. Older adults can't do this very readily. Younger adults sweat, and their blood vessels dilate to get rid of excess heat when it's hot. When it's cold, their blood vessels constrict to compensate by conserving heat. Older adults' bodies are less able to do this. This ability to compensate can be significantly worsened by many prescription and over-the-counter drugs. Drugs which have an anticholinergic effect can cause severe problems, for example, during a heat wave. Again, drugs with anticholinergic effect are such things as the antihistamines, the antipsychotic drugs, and the antidepressant drugs. More drugs prescribed result in a greater potential of an adverse drug reaction or a drug interaction. Since older adults use significantly more drugs than younger people, they have greatly increased the odds of an adverse drug reaction caused by a dangerous interaction between two drugs. Taking one or two over-the-counter drugs, along with several prescription drugs, further increases the likelihood of an adverse drug reaction. One of the most common kinds of adverse drug interaction is the ability of some drugs to cause a second drug to accumulate in the body to a dangerous level. This is most often due to the fact that one drug will interfere with the metabolism or with the excretion of another drug. And finally, inadequate testing of drugs in older adults before they are approved by the Food and Drug Administration. Although older adults use a disproportionate share of the prescription drugs, few of them have been adequately tested before they're approved by the Food and Drug Administration. Until recently, of the 200 most frequently prescribed drugs, only 17 of these drugs had a dose which was established for older adults. They always were careful to list a proper dose for an infant or a child, a younger adult, but not for an older adult. And older adults are usually the ones that take these drugs for 10, 15, or 20 years. The FDA is slowly remedying this problem by requiring that people on whom the drugs are tested should be representative of the population that will be using the drug. So we expect to see some improvement in this very soon. In summary, significant differences exist between younger and older patients. These differences aren't always realized by either the patient or by the health provider. By increasing the awareness of everyone that these differences do exist, some medication problems can be avoided. Now, before I leave this topic of adverse drug reaction, it might be appropriate to indicate just how extensive this problem really is. Is it something we should worry about? Well, I think statistics will show that, yes, we should worry about this particular problem. According to one well-conducted study in the United States, in 1985, an estimated 240,000 older American adults, that is, those 60 and over, were hospitalized because of an adverse drug reaction to a drug that they were taking before they were hospitalized. Each year, in hospitals alone, there are over 29,000 cases of life-threatening heart toxicity from adverse drug reactions due to digoxin. These are adverse drug reactions that occur in the hospital. Each year, more than 9 million adverse drug reactions occur in older Americans. 32,000 older adults a year suffer hip fractures attributable to drug-induced falling. 163,000 older Americans suffer from serious mental impairment, such as memory loss and dementia, which is either caused by drugs or worsened by drugs. 2 million Americans, older Americans, are addicted or risk addiction to minor tranquilizers or sleeping pills because they have been using them for at least a year. 71,000 older adults have developed drug-induced tardive dyskinesia, that is, involuntary movement of the lips, the face, the tongue. This the most serious and common and often irreversible adverse drug reaction caused by antipsychotic drugs is this tardive dyskinesia. 61,000 older adults have developed drug-induced Parkinsonism, again due primarily to antipsychotic drugs. To conclude the first of these presentations on medication problems, let me summarize briefly. Older adults are the largest group of prescription drug users. The more drugs we take, the greater is the potential for an adverse drug reaction or a drug-induced illness. We very often blame old age, just getting old, for many symptoms which are really caused by the medication we take. We also experience more adverse drug reactions than younger adults because of the changes in body weight, composition, in the decreased function of our liver and kidneys as we grow older. These changes can profoundly affect the way a drug acts in the body. Now you might ask yourself, as a consumer of drugs, what can I do to help me avoid some of these problems? Some suggestions you might consider are these. Know why you're taking a drug. Understand all the directions for taking that drug. If you don't understand the directions, be sure to ask your pharmacist or physician. They should tell you what the directions are, when you're supposed to take them, how you're supposed to take them, with what. Be assertive in this respect. Tell your doctor or pharmacist of any new symptom that you may experience when you start taking or adding a drug to your regimen. And finally, remember that such things as vitamins, cold and allergy pills, pain remedies, and other over-the-counter drugs, as well as alcohol, caffeine, and tobacco, may also cause adverse reactions or at least contribute to an adverse reaction when used with prescription drugs. Remember, it's your body, it's your choice. Keep informed.
Aha! There you are. Looking for your pills? It seems you need too many now to help you cure your ills. Like twice as many medicines if you're approaching 65, for sleep, blood pressure, for your heart, but they're keeping you alive. You can overdo it though, or mix them up a bit. Take this before that or after. What? You're giving you a fit. Remember what the doctor said and read labels carefully. Perhaps you need your glasses on so you can really see. Oh no, not that. You took that once today. I'm only a bystander. What can I really say? Get some help. Call a friend. Consult your doctor too, because I really look forward to looking back at you.
Next time we'll look at how adverse drug reactions or drug-induced illnesses may be caused by multiple drug use, by seeing more than one doctor, getting our prescriptions filled from more than one pharmacy, how non-compliance contributes to the problem. That is, when we don't take the drugs as we should or don't take them at all, how this can cause some problems. But most importantly, we'll see how to avoid or reduce the potential of an adverse drug reaction by following some guidelines for safer drug use.
Inquiries or questions or to receive a video of this program, contact Missoula Aging Services at 227 West Front, Missoula, Montana 59802.